A recent study in the Annals of Family Medicine compared the incidence of hypoglycemia unawareness in people who are using insulin and people who are taking sulfonylureas. These are the oral agents such as glyburide, glipizide, and glimepiride that increase the secretion of insulin. Hypoglycemia unawareness is when patients have such frequent hypoglycemic episodes that their body stops giving them warning symptoms. So there's two types of symptoms of hypoglycemia. That's what we call the adrenergic, which is caused by an increase in adrenaline. So that's the sweating, the palpitations, the jitteriness. And then there's the neuroglycopenic. That's when you're not getting enough glucose to the brain. That's when people get confused, or they can have seizures, or they can pass out. The study included almost 900 patients, but 41% of them were using insulin and 65% were using sulfonylureas. And if you're saying, well, that doesn't add up to 100, I suspect it's because some people were using both. They used two different kinds of questionnaires to determine whether or not the people had hypoglycemia unawareness. And in people who are using insulin, the incidence was about 41% using one questionnaire and 28% using the other questionnaire. And in people who were taking sulfonylureas, the incidence was higher. It was 65% using the one questionnaire and 53% using the other one. They also found that the incidence of hypoglycemia unawareness increased with duration of use in people using sulfonylureas, while it decreased with duration of use in people using insulin. Why is there a difference between the two groups? This study is unable to determine that, so it does warrant further investigation.